My social justice advocacy focus, I am particularly compassionate about advancing equitable access to trauma informed mental health services for adolescents in underserved communities. Throughout my professional experience as a counselor, I have encountered students whose trauma histories significantly impact their behavior, learning, and relationships. Many of these students, particularly those from marginalized racial and socioeconomic backgrounds, struggle to access consistent and culturally responsive care. This inequity has fueled my desire to advocate for systemic changes in counselor education and practice that prioritize trauma-informed and socially just approaches. My personal interest in this area stems from seeing firsthand how inequitable systems exacerbate a, the distress for students who are already vulnerable. For example, I have observed how disciplinary systems often punish trauma responses rather than support students in learning self-regulation. As a counselor educator, I see my niche as preparing future counselors to better understand the social determinants of mental health, as indicated by Paris et al., and to intervene with compassion and advocacy at both the individual and systemic levels. Professionally, my experiences align with both the Council for Accreditation of Counseling and related educational programs standards and the American Counseling Association Code of Ethics. CACREP emphasizes training counselors to work effectively with diverse populations, incorporate advocacy into their professional identity, and engage in wellness promotion across settings, indicated by Kleist and Goodrich. Similarly, the ACA Code of Ethics underscores counselors' responsibility to address barriers to access and advocate for systemic change. These professional expectations affirm that my advocacy focus is not only a passion but also an ethical and educational imperative. My chosen area of advocacy is to integrate trauma-informed care and social justice principles into counselor education. This focus directly aligns me with the multicultural and social justice counseling competencies, which call counselors to recognize the systemic and structural factors that shape client experiences. By equipping counselor trainees to understand how poverty, racism, community violence, and other social determinants affect mental health, we can better serve students and families while reducing disparities in care. Ultimately, my advocacy will focus on preparing counselors who are not only skilled clinicians but also change agents within schools and communities. By promoting trauma-informed, equity-centered education, we can strengthen both individual outcomes and the larger systems that shape mental health.